They said that we weren't allowed in because they were afraid of community spread because my mom was COVID positive. So we weren't allowed in for our safety and so that we didn't spread it to the community. But now that that 14 days is over, now they say we are the threat because we're not vaccinated.
They need to know how inhumane this is.
Mm-hmm.
They need to know that they are not looking at the best interest of the patient when they're not allowing family in, especially someone in critical care who's trying to wake up from a coma. They need familiar voices around them. They need the touch of their family. And I think even if you get nowhere, still try.
Mm-hmm.
Hospitals and policymakers need to know that this is not okay. They need to hear that over and over and over until hopefully eventually it does make a difference.
Warning, censorship. Warning, censorship.
Tamara Ugolini here with Rebel News, and I have been following the unbalanced, narrow-minded approach that institutions have taken to COVID-19 since the onset of the pandemic. If we fast track now, 2 years later, and the restrictions just seem to be getting tighter instead of more ethically weighted and balanced. The protocols being followed by hospitals specifically have been dehumanizing and left many people nervous to seek medical care and sown extreme distrust in the medical profession. The story that I am bringing you today is no different. Sister advocates Susie Prasad and Janet DeBoer have been fighting for their mom, Ursula, who wound up in hospital after several days of illness, where she later tested positive for COVID-19. But she only took the test because she thought it would be her ticket to allow visitors and family in to visit her. It became clear thereafter that as unvaccinated individuals, Ursula's husband and her children would not actually be allowed entry into the hospital to visit their ailing mother because of an alleged risk that they posed to the other staff. And the doctors, citing strict protocol, are too scared to administer anything that may be contrary to the treatment protocols established by the government of Ontario, including what they call experimental IV therapy, despite Ursula's family wanting her to have it. The one thing that the family was successful at was advocating against the use of remdesivir, an antiviral approved by the FDA under emergency use authorization in COVID patients, which has actually shown to provide questionable benefit and been observed but not thoroughly studied in its relation to acute renal failure, otherwise known as kidney failure, when used in COVID-positive patients. Let's hear the series of events from Susie and Janet themselves. Check it out.
Mom had been sick for quite a few days, but then Dad called on Wednesday morning and said that she was really not doing well and he needed help. So I went over that day and Mom was just so dehydrated and was not doing well. At that point, we did not realize that she was actually having a really hard time breathing. She seemed like her breathing was not labored, but I called quite a few people asking for advice. And
in order to hear what they say, however, uncensored, you will have to click on the description below and follow the link where it says full report. You do not have to pay for this content. We just can't risk posting it in full on YouTube, as the censorious thugs at the Ministry of Truth deem what we will say as wrong speak. And we want to make sure that even our YouTube subscribers continue to see our great content. So again, please scroll down, click the description below, and where it says full report, you will be redirected to the story on a platform that does not censor its channels. I'll have to see you over there.